facial nerve is supposed to supply lacrimal gland, sublingual gland, submandibular gland, and also carry taste from anterior two-third of tongue. Cauda tympani nerve is a branch of facial nerve. All that. Do you remember something? Where is the facial nerve coming from? At the pontomedullary junction. If you say facial nerve is coming at the pontomedullary junction, fine. As the facial nerve comes from what? The nuclei are in the pons. Maybe the nerve is exiting at the pontomedullary junction, but the nuclei are in the pons. So there are some nuclei in the pons, yes. But the nerve exit at pontomedullary junction, yes. Okay, fine. Then you have to understand that it is going to supply some pterygopulsant ganglion to control LNP gland. It is going to supply submandibular ganglion to control the sublingual submandibular salivary gland. It is controlling lacrimal gland, sublingual gland, submandibular gland, also carry taste from the anterior two-third of tongue. Actually, facial nerve is supposed to supply lacrimal gland, sublingual gland, submandibular gland, and also carry taste from anterior two-third of tongue. Cauda tympani nerve is a branch of facial nerve. All that, and it also supply muscles of facial expression. It also supply muscles of facial expression. This is all facial nerve territory. Okay, lacrimal gland, sublingual gland, submandibular gland, taste also, nasal gland, palatine gland, all that? Yes, fine. What if there is a Bell's palsy? If there is a Bell's palsy, depends which level it was injured, and some clinical features may be coming, some may be missing. So depending on the level of lesion, yes. Okay, what about this patient now? See, the muscles which it is supplying are muscles of facial expression. Could be orbicularis oris. Shut the eyelid. Oculi, this is orbicularis oculi, shut the eyelid. Orbicularis oris will shut the mouth. When you whistle, this is orbicularis oris. So, orbicularis oris will help me to whistle, yes. And then I will shut my eyelid tightly with orbicularis oculi, yes. Then you have zygomaticus major for smiling. You have zygomaticus major for smiling. And you have buccinator. What is buccinator for? Sir, you are making a fake smile. Yeah, fake smile. I can smile also. But sir, you are laughing now. Yeah, okay, fine. But zygomaticus major is basically for smiling, smile muscle. Why are you telling them like that? Because I have to discuss a patient now. What patient? See, this patient. Why, what happened here? Bell's palsy. What Bell's palsy? What happened? Actually, there is failure to close the eyelids. Why? Orbicularis oculi paralyzed on left side and cannot smile. Why cannot smile? Because zygomaticus major is not working. There is dribbling of saliva. Why dribbling of saliva? Because buccinator muscle is paralyzed. Buccinator normally keep pushing the saliva towards the cut tube. But if buccinator is not working, this is left side. If buccinator is not working, dribbling of saliva. So dribbling of saliva, yes. And cannot smile? No. And this cannot. So you mean to say I have to pad the eyeball? Yeah, you have to pad the eyeball. And you have to tell the patient, put the finger into mouth and take the food out, because collection of food here, because buccinator is not working, all that problems. Facial palsy. Okay, facial palsy, fine. What else? Now we have to go into the details of the nerve. This is the lady you have discussed. Let us talk more details. Go deeper now. The branches, yes, branches. Okay, let's go deeper. This is the diagram which we are supposed to draw, but before you draw the diagram, you just see the details, then you draw. So what are the details? Do you know that anterior two-third of tongue taste is carried by cauda tympani nerve towards the facial nerve towards which nucleus? Taste of the anterior two-third of tongue. Taste of the anterior two-third of tongue is carried by cauda tympani nerve towards the facial nerve. Towards which nucleus? Towards the tip of the nucleus tractus solitarius. Towards the tip of the nucleus tractus solitarius. And what about the other nuclei of facial nerve? Other nuclei of facial nerve you have seen, but first you tell about the geniculate ganglion. Where is the geniculate ganglion? It is in the middle ear cavity and it has some taste sensory neuron. So, this is the geniculate ganglion which is in the middle ear cavity having some taste sensory neuron. It is in the taste pathway. Yes, it is in the taste pathway. Then you have superior salivatory nucleus controlling 5 glands on the face. Remember those 5 glands using 2 ganglia? So, you are telling this is some superior salivatory nucleus controlling 5 glands on the face, 2 ganglia. Which ganglia? Which glands? The glands are L for lacrimal, N for nasal, P for palatine, and then one is under the tongue, sublingual, under the mandible, submandible. 5 glands of the face controlled by facial nerve and 2 ganglia. What are the 2 ganglia? One of them is called as the pterygopalatine ganglion, the other is called as the submandible ganglion. And what are the nerves carrying the preganglionic fiber then? Preganglionic, yes. See, pterygopalatine ganglion, which is controlling L for lacrimal, N for nasal gland, P for palatine gland, will have one nerve called greater petrosal nerve. And if you are talking about the sublingual, submandibular, then cauda tympani nerve. Can I see cauda tympani nerve, greater petrosal nerve then? Yeah, okay, let's see. This is the greater petrosal nerve which is controlling the pterygopalatine ganglion to control the LNP gland, and this is the cauda tympani nerve which is controlling sublingual, submandibular salivary gland. They carry only the preganglionic fiber. They are branches of facial nerve. These are the functional nerve. So, if they are functional nerve, then who is the topographic nerve? Topographic nerve are the trigeminal branches. If you say topographic nerve are the trigeminal branches, they will be carrying the postganglionic fibers now. Yes, you already know that. Topographic is trigeminal. So, this is the trigeminal nerve. Tell me about the topographic nerve. Trigeminal is giving 3 branches and they will be topographically related like which one? This is we have discussed here. What is this? Mandibular nerve giving the lingual nerve. You are talking about the lingual nerve branch of the mandibular nerve branch of the trigeminal nerve, now the topographic nerve. Yes. Remember, lingual nerve, which is a branch of the mandibular nerve branch of the trigeminal nerve, is joined by cauda tympani nerve. Cauda tympani nerve is joining lingual nerve in the infratemporal fossa is one MCQ. You are telling cauda tympani nerve will join the lingual nerve in the infratemporal fossa. Infratemporal fossa? Yes, below the temporal bone, infratemporal fossa. Why? For? See, lingual nerve is going to carry the postganglionic fiber towards the sublingual and submandible salivary gland. So, lingual nerve is carrying postganglionic fiber towards sublingual, submandibular salivary gland. Who was carrying the preganglionic? The cauda tympani. So, cauda tympani nerve carry only the preganglionic fiber to the submandible ganglion, and the postganglionic will be carried by the sublingual, submandibular salivary gland, the branches of lingual nerve, topographic nerve. Now, once you have that idea, fine. What is this internal carotid artery doing? Internal carotid artery, you remember, was surrounded by some T1 sympathetic plexus. That T1 sympathetic plexus around internal carotid artery is giving a sympathetic nerve, and that sympathetic nerve is called deep petrosal nerve. So, there is a deep petrosal nerve which is coming from the T1 sympathetic plexus. Yes, actually. Around the internal carotid artery, you have some T1 sympathetic plexus coming from superior cervical ganglion. Superior cervical ganglion gave you some T1 sympathetic plexus, making a plexus around the internal carotid artery, giving a sympathetic nerve called deep petrosal nerve. Now, it is joining greater petrosal nerve, which is a parasympathetic nerve. Greater petrosal nerve is a parasympathetic nerve. So, what will happen when they join? When the greater petrosal nerve, which is a parasympathetic nerve, joining the deep petrosal nerve, which is sympathetic nerve, they will together form the Vidian nerve of pterygoid canal, and you can cut the Median nerve of pterygoid canal if you have a case of vasomotor rhinitis with intractable rhinorrhea. You are having a case of vasomotor rhinitis with intractable rhinorrhea, running nose. You cut this nerve. Which nerve? Videonectomy. Yes, videonectomy can be done. Though it is no longer performed operation, but it has historical importance. That's why questions still come. So, videonectomy. Yes. For a case of intractable rhinorrhea, yes. This nerve is supposed to go towards the pterygopalpine ganglion and then control the nasal gland. So, it is going towards the pterygopalpine ganglion, then controlling the nasal gland. Yes. You could have cut that nerve to reduce the secretion of nose. Okay, fine. What about this facial nerve exiting cranial cavity? Facial nerve has to exit the cranial cavity passing stylomastoid foramen, and then it will pass through the parotid gland and supply the muscles of facial expression like you had orbicularis oculi or the zygomatic or the buccinator or the orbicularis oris. But before it supply the muscles of facial expression, it already has passed through the parotid gland, and before that it has passed the stylomastoid foramen. Now, maybe facial nerve is passing through the parotid gland. It do not supply the parotid gland. Parotid gland is supplied by glossopharyngeal nerve. Facial nerve just passes through the parotid gland without supplying the parotid gland. Parotid is supplied by glossopharyngeal nerve. This information we needed. Now, this is the case you are talking about, and you have to draw a diagram for that. So, this is the case we are talking about. We have to draw the diagram. But before you draw the diagram, you just have some idea of the middle ear cavity, and there you will have some branches given, like there will be greater petrosal nerve, there is the nerve to stapedius, and there is the cauda tympani nerve. You are now going into middle ear cavity. Where in the middle ear cavity? Here. This the area will magnify? Yes, magnify this area. So, when we are magnifying this area, what is there? See, this is the genu of the facial nerve, external genu. Where is the external genu of facial nerve? It is external band of facial nerve in the middle ear cavity. There you have the geniculate ganglion, and after that is given the greater petrosal nerve, which is going towards the pterygopalpine ganglion to control the LNP gland. It is topographically related with maxillary nerve, branch of the trigeminal nerve. See, this is the genu, external genu of the facial nerve in the middle ear cavity and giving the greater petrosal nerve, which is topographically related with the maxillary nerve, branch of the trigeminal nerve. And what else? See, this is the facial nerve in the facial canal. Where? In the posterior wall of the middle ear cavity. If you say this is the facial nerve in the facial canal, in the posterior wall of the middle ear cavity, then it is giving three branches. What it has already given, that was the greater petrosal nerve. What is the second one? Nerve to stapedius. And what is the third one? Cauda tympani nerve on the tympanic membrane. If you say cauda tympani nerve is on the tympanic membrane, it is related to the malleus bone also on tympanic membrane, then where is it going? It is going to join a branch of the mandibular nerve trigeminal, name lingual nerve. Where? Infratemporal fossa. So, you are telling this is the lingual nerve, which is a branch of the mandibular nerve, branch of the trigeminal nerve. Yes. And what is this joining? Where it is? Infratemporal fossa. Remember, cauda tympani nerve carry the preganglionic fiber towards the submandibular ganglion. Later, it is the lingual nerve which will carry the postganglionic fiber. How the facial nerve is exiting the cranial cavity? Facial nerve is exiting cranial cavity passing stylomastoid foramen. After that, it will supply the muscles of facial expression. So, this is the diagram which we want to follow. Yes, this is the middle ear cavity. You can see there. The roof is tegmen tympani. You are telling that the roof of the middle ear cavity is tegmen tympani. Yes. Then what is the posterior wall? Posterior wall, you have the facial nerve running. And what is the lateral wall? Lateral wall will be tympanic membrane, where you have this cauda tympani nerve. Cauda tympani nerve is the lateral wall of the middle ear cavity on tympanic membrane. Yes. What is the anterior wall? Anterior wall is this eustachian tube, bony part. Bony part of eustachian tube is anterior wall of middle ear cavity. Yes. Roof is the tegmen tympani separating from the brain here. Yes. Yes. Okay. We'll discuss middle ear cavity later also.